All right, thank you so much. The meeting is now being recorded. So we had heard from a couple of partners the question of when are we going to start meeting in person? Now that there are a number of folks who are vaccinated, there's a loosening of some of the guidelines around meeting in person. We wanted to poll the Altogether group and figure out how many of our partners are comfortable meeting in person, with the thought that we would continue to have a virtual option for those who maybe aren't comfortable, or if for some reason you can't make it to the meeting in person and want to still join virtually. So we wanted to first poll everyone and see what that looked like, how many of our partners felt comfortable with that. So we've only had a few people respond to the poll so far. So we'll put the link to the poll in the chat, and we'll also send it out in the meeting minutes. And then once we get sort of an overall understanding of how our partners are feeling about meeting in person, or having that virtual option, we will take some time to figure out some different meeting facilitation strategies and how to figure out the technology around how would we actually make this work so that there would be a virtual option. We would have to figure out where we would meet in person, and figure out the technology needs that we would have in a potential meeting space. Some organizations still have some limits on how many people can meet in person, and we would probably still ask everyone to wear a mask when we're meeting in person, just to keep everybody safe. And we don't want to ask vaccination status. That is protected health information, so we would ask people to stay masked if we were in person. But just wanted to get a sense from folks. If anyone had anything they wanted to add, feel free to do that. I will put the link to the poll in the chat for those of you who haven't been able to take that. But has anyone had other meetings that they've been a part of go from this virtual space back into an in-person and have a virtual option? And how is that working? If you guys have, we've just barely started to dive into what that would look like from a meeting facilitation and technology standpoint. So if folks have seen this work successfully and have tips that they want to share, that would be great. Matt?
I serve on a committee, and we just started the in-person meetings back on Monday, and we did the virtual option for a few folks that couldn't make it for one reason or another. And we did it exactly like what we're doing now. We met as a group. We had a laptop set up in exactly the same format that we're using right now, but it was at the end of the table, so it captured who was sitting at the table, and we could see the images of the other people that were participating. It worked very, very well, with one exception. We were in an upstairs room that had a metal roof, and the heavens opened up, and the rain was so loud that it was very hard to hear the people that were on the computer. But other than that, everything went fine without a hitch. Able to record it, people were able to participate, and it worked quite nicely.
Great. So maybe some portable speakers might help with the sound issue coming out of a laptop. That's something that would be good to look into. Anyone else? Has anyone else seen this work successfully so far? Bob?
Yeah, I've been in a similar meeting with a referral group, and the Zoom thing is really convenient for particularly people that were coming from a long distance. So that was a piece of it, and then the rest of the people were in a room, and technology-wise, it kind of worked. But one of the things, and being in broadcasting, trying to get a group of people at a table to be able to use a condenser microphone that's up here on your laptop screen is really not, no pun intended, but sound advice. Because as Matt was saying, when it started to rain, the microphones on laptops go looking for sound, and the dominant sound in the room is the loudest thing that you hear. So we've been trying to work out a way to put either different mic inputs in the room and kind of cluster people together so they could actually interact without having so many audio issues. The video wasn't a problem, but trying to separate people out really was. So we haven't really come up with a solution for that yet, other than having people sitting closer together. But the guy who's running our meetings is trying to find a what they call like a cardioid microphone, or multiple microphones that could be put on the table, like at a town, at a city council meeting, where you might be able to input that, and there would be close mics where you could just hear their voice instead of, the cat purring across the room that sounds like a lion roaring, that kind of thing. So that's what we've been doing. And from my standpoint, being in the room seems to be much more dynamic, but the convenience these days seems to work really well for people too. But audio is challenging.
Yeah, definitely. It's interesting to think about. We took us a while to adapt to a virtual space, and now it's going to take us some time to readapt to being back in person, and also try to include this virtual space that we've now all been living in for a year and a half. So as folks start to come across this working well, if you come across things that are working well or not working well, please feel free to send them over to us, because we're just now trying to figure out how we're going to make this work for our group and our partners, and are open to suggestions and ideas that you guys might have. So I appreciate you guys sharing, and feel free to send us some more things as you are approaching this with your other meetings. Andrea, do you want to do your updates next?
Sorry, I had a tab kept coming up over my mute button and I couldn't get rid of it. So sure. So I don't actually have a lot of updates. It's kind of that weird time where my fiscal year just ended. So I'm doing some annual reporting, and then kind of Hillary and I are starting, and Lauren, looking at, planning for the upcoming year, just, what that's going to look like in the calendar. But a few things that we wanted to share. So we just wrapped up our community survey. So as a reminder to people, that is a survey that we put out to adults, caregivers, parents in the community, to get their feedback on what they are seeing in terms of substance misuse, their thoughts, perceptions, feelings about substance misuse in our community. Some questions are, like perception of harm of youth under 21 using substances versus what that looks like under 18. Just a lot of different questions like that. So we wrapped that survey up on June 30th. Unfortunately, we only had, let me just pull up this number. We only had 225 people complete the survey for the Upper Valley. It is something that we did joined with Greater Sullivan County. But for the Upper Valley, we only had 225 responses, which is down nearly 47% from 2018. Which is a really, really big bummer for all the work that we put into it. But I think we have a whole host of ideas of why that number is so low. I think people, nothing concrete, but just some of our anecdotal ideas is that I think people are super burnt out just in the virtual world. So we've had a million surveys about just how's the pandemic affecting you, and this, that, and the other thing. So I think people are kind of survey and virtual screened out. Just with the timing, we weren't really able to do any in person. So we lost a lot of that, in getting people to fill out pen and paper things, which I don't think we would have gotten a great number with, but still we kind of missed out on that. And then as much as we tried to avoid it, we had a little bit of just timing conflict with Dartmouth Hitchcock. And I don't know if Alice Peck Day put theirs out at the same time, but they put out their community health needs assessment out at around the same time, a little bit later, and they just have a lot more manpower to get that out, and that's a kind of a more prominent survey. So I think we just had a number of barriers sort of in our way. So regardless, we'll get some of that information. It's not going to be super representative of the entire region, but at this point we have, the data we do have is 3 years old. Our evaluators think that they'll get us a full report, which will be broken down by school district, I think at the end of August, early September. So that'll be really great. And then we'll try to do some focus groups, moving forward with that. We're going to partner with the TDI students at Dartmouth College to help us with those focus groups, which will take some of the work off of us. to getting that done. So we're excited just to, dive in a little bit deeper after we are able to review that data. Any questions about the community survey? We have a lot of lessons learned. I mean, we will do it again in 2 years. So definitely lessons learned on how we hopefully can increase those numbers next year. But, it's a start for us. And then the other update is that, Lauren, if you don't mind plugging it in, I didn't pull it up, but we have finally finished our website. We revamped it. We've taken the better part of nearly a year to get that finalized. So it went live last month at some point. So there isn't really any new information on the website. It just looks much more updated. A nice cleaner version. And then on the back end, we made it so that it's easily updatable for us. We did go through a training so we can, if you find anything major that needs to be changed, we should be able to make those changes. So please feel free to email any of the 3 of us or all 3 of us, and we can change that. But we think we made it relatively user-friendly. We think it captures a lot of the information that we would want people to have. And we're just excited to have finalized that project and get the live site going. Thanks, Lauren. She just put the link in the chat, so check it out when you get a minute. I feel like that's it for me. Did I say I was going to go over anything else? I think that's pretty much it for me.
That's it. Thanks, Andrea. One of the things I think it came out of an officer meeting, which you'll notice on our website is there's a section for what to do, like resources for if you're in crisis. So we did pull out some resources. So if someone's in a crisis, they don't have to search our website for resources. They can go to that area and ton of information. So I think that was a suggestion that came out of an officers meeting. So just wanted to point that out, but it does look really nice. But please feel free to email us if you see anything that needs to be changed. There's a ton of information on there. Lauren, updates from you?
Yes, thank you. So you might remember that in, May and June, we ran a mental health campaign called Seize the Awkward on social media and the radio and Spotify. And so that that phase of the campaign is closed now, so the ads are not running anymore. So we sent out a survey that we wanted teens and young adults to take who live in the Upper Valley or Greater Sullivan County regions. And we had a bit of a viral response to that survey, but not in a good way. Somehow the link snowballed and we got hundreds of responses from all over the country. So we've had to close the survey because that's obviously not our target population. So we've had to close the survey and create a new survey link, which I sent out yesterday, I believe. Hopefully you all received it, but if you didn't, you'll get it in the minutes. If you could help us to spread the word about this new survey link, again, for 16 to 25-year-olds who live in the Upper Valley or Greater Sullivan County, there's an opportunity to win an Amazon gift card. We'll be doing a raffle at the end of all of the valid entries. We're really trying to get as many responses as we can, but we might want to keep it open a little bit longer than we initially intended just because of this issue we're having. But really, we're trying to measure any impact that the campaign had on people who saw it, whether their knowledge, attitudes, behaviors around mental health, talking about mental health, suicide prevention, whether it had changed from initially before this campaign ran and then after if they saw the campaign. So we will send that out. Yes, so there is, the survey link is also on our Facebook. So you could share our post on social media if you have social media pages. Feel free to send it to family, anyone you know within that that age range. And let's see, that's all for the mental health survey. We had an ask from Kim Ip, who sometimes attends our meetings. She's from New Futures. They are looking to put together a panel discussion about immigrant health and health equity in New Hampshire. And so she's looking for a panelist from the healthcare sector who might be able to serve on that panel. So she's looking for someone who works with immigrant communities and can sort of speak to the issues that affect that community and their experiences. So far, she hasn't had any luck finding anyone, so I figured I'd throw the ask out to all of you to see if you might know of anybody. They can be from our area or anywhere in the state. She's looking for anyone that works with that, those communities. So if you know of anybody, feel free to either pass the name along to Kim if you know her, or you can feel free to send it to one of us and we'll get it to her. Lastly, I just want to say a little bit more about Danielle joined us this week, and just want to talk a little bit more about what her role will be. So in addition to the substance misuse prevention coordinator and the continuum of care facilitator roles from the regional public health networks, those are state grant funded positions. We also have a state grant that focuses on young adult strategies. So we have brought Danielle on to help us coordinate those strategies for the next year for both regions, for the Upper Valley and GSC. So she will mostly be working on trying to deliver some trainings in the community to young adults. We're going to be targeting colleges and businesses and employers that employ young adults. 18 to 25 is the target for that grant. We'll also be working on a few other things, including a mini assessment of the assets and gaps specifically around young adult health and wellness. So we'll definitely be calling on you guys to help us with that mini assessment. You know, just pick your brain and learn about what the assets and gaps are in the Upper Valley. So I just wanted to explain a little bit more about Danielle and what her role will be. So she'll join these meetings, and yeah. Danielle, anything else you want to add?
No, I don't think so. Thank you.
Okay, cool. I think that's it.
Awesome. Thank you.
Mhm.
While there's a momentary pause, I was just going to say goodbye to everybody. I unfortunately have to run. I will look to read the minutes. I'm excited about hearing the new programs, and welcome to all the new leadership.
Thank you. Have a good afternoon.
Yes, you too. Take care. Bye-bye.
So for those folks who were at our meeting in May, if you'll remember, we did some breakout groups, and we really wanted to take a look specifically at the impacts of COVID-19 on mental health and substance use. And so those notes were taken and sent out to folks, but I'm going to pull them up now. We're going to revisit, let me just make sure I pull them up right. And I'll put the link to the Google slides. Can you guys see this?
No, we see the P card.
Files.
Oh my gosh, I have so many things open. There. You seeing that?
No, it's a gray screen.
Loading.
Goodness. Says it's there. Oh, that's probably why.
Now we see it.
Okay. For some reason, it's open in two applications. That's weird. Okay. So I will put the link to this in the chat too, or if Andrea or Lauren, if you guys have it open and can do that easier than me trying to lose the screen. So these were the notes that we had taken at our May meeting, and we wanted to revisit this and go a little bit deeper with folks, specifically looking at this question, what is going on to address the impacts of COVID on mental health? So we wanted to revisit this question and then push you guys a little bit further to really talk about, the gaps and how can we as all together have an impact in what we're seeing. So wanted to pull out a little bit of what was talked about in May, specific to addressing the impacts that COVID-19 has had on mental health and substance use. And so what folks have mentioned in May, there were a lot of wait lists, talking about how do we bridge the gap for folks to get services who need it. Stacy had mentioned at Hypertherm, the You Matter and the naloxone boxes, AEDs, other supportive services. There's a strain on clinicians and service providers because of the need is so great right now. The question around what support services are available until someone can be seen by a mental health clinician, some harm reduction, Turning Points doing the follow-up care when an overdose shows up in the ER or at home, help in a crisis moment when motivation might be high, jobs, internships. It's tricky to implement policies around vaccination and masking, personal rights. So wanted to make sure that folks had this information and what was previously talked about, and then wanted to push ourselves to have an open discussion. We're not going to go into breakout groups, but want to have a group discussion and really answer the questions. What are the gaps right now? What are the gaps that you guys are seeing? And then talk about what we as all together can do to address these gaps and what impact can all together have on the mental health and substance use impact related to COVID-19. So first of all, does anyone have any questions about the current slide that's up, the what is going on to address the impacts that we discussed in May? Anything that folks want to highlight or bring up before we dive a little bit deeper? I can't see everybody anymore, so if you have something, feel free to unmute.
Am I the only one that thinks it's really, really tiny and hard to read?
Let me make it bigger. Now that's too big, isn't it? Oh, goodness. That's now too big. Is that too big now, Matt?
Not for me.
No, I think that's good.
Okay. All right. Anyone have any questions or initial thoughts? Are these things still happening? I mean, May was a couple months ago. Are we still seeing these things going on?
I can tell you that overdose is still a very significant issue. It's not letting up. And, whether there needs to be a specific reaction to it, such as increasing availability, or when I say availability of naloxone, I don't mean, people being able to get it. It's not that it's hard to get, it's that people may not be aware that they can get it or where to get it, that they can get it at no cost. That might be a possibility, making people aware that they can ask for it without putting themselves on the radar for law enforcement. It is okay to call 911 for someone who's overdosing. It doesn't mean that you're now an accomplice to a crime. That type of thing.
Okay.
But
So
I
that kind of
think
gets at a potential gap or way that altogether might be able to have an impact.
I also think that the whole COVID issue is complicated because of different protocols in neighboring states. For example, you were talking about protected health information and such. Employers do have the legal right. The U.S. Attorney General did say that employers have the right to ask vaccination status of its employers. People have the right to either answer or not answer. For anyone who doesn't answer, employers have the right to either restrict the type of work they do or to mandate certain PPE protocols and such. I know the whole mandatory vaccination is a whole nother topic that's being bandied about. But I think that one of the issues that's coming on right now is that people that are not vaccinated for whatever reason are facing some blowback. And I don't know if it's people are being too sensitive. Oh, you're hurting my feelings by criticizing me for not being vaccinated or what, but people are getting very angry at those who are not vaccinated because of its very, very real negative impact on the nation as a whole. And the reaction is, hey, I feel attacked. I won't share my personal feelings on them being attacked because, well, I don't have the tact for it. But I think it is a complicated issue. I just wish I could get everyone vaccinated, then there'd be no issue. And I'll be quiet now.
So,
Oh, can I ask a question, Matt? When you said the Attorney General, do you mean the state's Attorney General or the U.S. Attorney General?
U.S. It was
Okay.
national news almost 2 weeks ago. They weighed in and said there is no HIPAA violation or violation of patient privacy by asking the vaccination status. They quoted pre-existing statutes that schools use for vaccinations.
Mhm.
And the CDC has been using for tracking things. There are certain diseases, medical issues out there that are mandatory tracking. And they said this is asked and answered generations ago. There's no all of a sudden this
Gotcha.
personal right to keep your vaccination status a secret. It just doesn't exist.
Gotcha. Okay, well, the reason that prompted a question, I know our company had sent out information to us regarding, encouraging the use of vaccination, but neither asking nor demanding to have that done. And I think, the impacts of COVID on mental health within the workplace, at least from what I've seen, is we've been in kind of a general malaise or, some form of, group depression. And, we're finding ways to cope. And I think one of the things that I've noticed is that within the workplace, there are people that have been vaccinated and they've been very open about it. And others that have not said anything. However, since we now have a lot of information regarding the Delta variant and how that is manifesting itself in the unvaccinated population, is it okay for an employer to mandate that people that are not vaccinated to wear a mask in the workplace or work remotely? And that has a direct impact on certainly the mental health of your staff, because it's like, okay, how do we work around this now or again? And I don't know as if there's any, like you said, it's complicated. But I asked that question because it actually came up in an email that went out to the company, and somebody said, well, what about the people that haven't been vaccinated? Should they be allowed in the building without a mask on in front of people that might be older, or might be at higher risk? So I don't know what the answer to that is.
It is definitely tricky, and I don't know if anyone has the answer. So I think, thinking about the gaps that we're seeing, are we seeing that as being a gap, or is that just an unanswered question that folks are curious about? I mean, I don't think vaccination status is necessarily related to mental health and substance use impacts of COVID, but maybe it is. Maybe folks are seeing that directly tied, and that's fine.
Well, I just think it's another thing people have to worry about. It's like, okay, well, it's
an added stressor.
I think there's particularly in Vermont, New Hampshire, where vaccination rates are very high, and I think there was generally a sense of relief among people that, okay, we have an adult population that's, for better, for worse, quote unquote, doing the right thing. But at the same time, it's like, well, okay, well, that's great. But, reality is you're not going to get 100% vaccination rates. And how do you deal with now, the stress of trying to figure out how you work in the workplace now that we're at stage 2 or stage 3 of this thing. So that, that makes it, I'm sure that weighs on people.
Well, and I think it
go ahead.
I think it brings up the idea that we, I think, should start to be prepared to see how schools are going to handle this also, because like Matt said, with the Delta variant, and I don't know if you made up the Lambda or if that's like another strain that's starting to come out that I just haven't heard of yet. But you know, all of these variants, especially with, you know, the younger children not being able to be vaccinated at this time, you know, my concern is what are we going to look at for schools in the fall, in the spring? Or, you know, is it going to be more than just requiring students to keep wearing masks? Or are we going to look at another year of the mental health of students going downhill because maybe we're going to do more of that? We'll start off in person, but if there's a lot of cases, then we'll go remote. Like, you know, I think that's something that we should think of. And again, not saying that altogether has power to, you know, affect change with that, but I think it's just, you know, from the activities that we do, that's certainly going to impact what we're able to get done if schools, you know, aren't in person come fall and stuff. So.
And I think too, you know, not knowing necessarily what schools are going to look like in the fall and what we are going to potentially be able to implement with schools, it might be that if maybe we need to play it safe and think the worst and think that schools are going to end up remote again, and maybe we need to plan for our activities, all of our in-person activities to be happening on the beginning of the school year, and try to get as much prevention messaging as we can at the start of the school year, knowing that there's a high likelihood that schools are going to go remote. Matt, you had your hand up.
Yeah, and hopefully you guys can hear me because my internet has been cutting in and out throughout
You're
this whole
good.
process. I think, Bob, I heard a total of about 7 words from you,
Oh,
and I know you well enough to know you said more than that. So just a couple things. Yes, Lambda variant is real. It's emerging, and they're worried about it because they think that the Lambda variant may not be covered by the vaccines. They're not sure yet. That's why they're talking about it now. And they're talking about it because they're thinking if a booster, a third shot, is necessary, they want to make sure that they cover the Lambda variant. So far as schools go, the CDC has already made a decision, which is not mandatory, but they've rendered their opinion, and that is, one, schools should be in person. Two, everyone should be masked regardless of vaccination status. One, because it protects the health of those who aren't vaccinated. Two, it eliminates the whole stigma factor of vaccinated versus non-vaccinated. And they're very, very concerned about the mental health of not only students, but of educators. So they think let's do this in person, let's do it all together and all be on the same page in terms of protocols and protection is the way to go. They feel comfortable enough with that. And they're really pushing very, very hard to get the 2 years and up group approved in terms of vaccinations. I've been doing a lot of vaccination clinics for state of Vermont. And I've done some of the kids, you know, I've done the 12 and up. And well, first of all, they're not big babies like the adults, but they're very, very glad to get it. And the thing is, now I'll be able to go to school, and I tell them, so far as I know, yes.
so thinking about schools and planning for potential activities that altogether could look at implementing to help fill some of these gaps. What are folks seeing as gaps right now? Whether it's related to schools or to employers, or I don't know, Matt, if you've been vaccinating some of the teens, if you've heard from them different things, like if you've been able to have conversations or you're picking up on some things that kids are saying, like what are we seeing as gaps currently?
Consistent information, misinformation, especially because kids are so electronically tuned in. There's a tremendous amount of misinformation out there. And I'm not just talking about Snapchat, Instagram, Facebook, because I'm older than dirt. I don't know all the social media stuff. Kids do know it, and they talk to me about stuff, and my reaction is usually like, "Kid, what the hell are you talking about?" And they're hearing things that they think are legitimate or coming from legitimate sources that are just so far out there. So misinformation is a big deal. And I don't know that altogether can necessarily take on that task because you'd need to triple your budget and your staff. So you could have people going to schools, going all over the place. But any kind of public information campaign that we could do that says, here are the real facts, you decide, would be helpful. And we can do it simply by using plain old science, what we know to be facts. Go to the CDC, go to the WHO, the stuff that is real, like gravity. Um, just use that.
Yeah, Matt, so you mentioned that, you know, maybe that's not something that falls under like the purview of Altogether, but we work, Lauren, Hillary, Danielle, and I work with the emergency preparedness people that are part of our regional public health network for the Upper Valley and then for Greater Sullivan. So that's certainly something that we can bring back to them as well. You know, that's something maybe that they can take the lead on, and we just share that information if they develop some campaigns. So that's an idea.
What are other gaps that folks are seeing? I'm interested to hear from Ryan and from Lindsay what you guys are seeing, and then Liz, if you're seeing things from the Alice Peck Day point of view as well.
I can go if you want.
Great.
So I think it's really interesting because I work with a bunch of adolescents outside of diversion, and there's definite anxiety that's not been there before. And I think it's like a level of stress. It's almost twofold because they're more relaxed, but there's like this fear of it happening again. And then like this whole acclimation of like, am I okay to relax and get comfortable? And I would say that's like 17 to 21. Like I survived, but I really don't want to do this again. And am I okay to get excited about my senior year? Am I okay to get excited about going to college? Like they're just waiting, I feel like, for the other shoe to drop. And there's just so much mixed messaging happening about COVID in general that they don't know what to do. And I think for us at Diversion, it's definitely truancy, big concern. And there's also concern about increase in substance use, especially alcohol.
Lindsay, are you seeing related to an increase in substance use? Do you feel like it's increased because you know, they're using it as a coping mechanism?
I think it's coping and then bored.
Yeah.
Like I can't do anything. So I think it's both. You know. So yeah.
Do you think what do you hear or know in terms of like access to substances? Is it from the home mostly, from friends, from older siblings? Like
I think if kids want weed or alcohol, they find a way to get it. It doesn't matter what the parents say. If it's not allowed, like they find it. It is so accessible. Like fake IDs, I know kids with 3 of them. Like it's just like you can buy them online for $50.
Oh boy.
So it's just easy. So those are my 5 cents.
So I would love to hear from people, just to take this opportunity as like a brainstorming, and remember that anything that you share or offer as an idea, like you're not held to it. We're not going to come back to you in 3 months and say, hey, you brought this up. Can you take this project on? Like we just want people to throw out there. So after hearing you know, some of those ideas that people have talked about, and anything else, you know, what are some things that you think that Altogether could do that we haven't necessarily done in the past to address some of that? So to, you know, because I'm thinking, I know somebody in one of our million surveys brought up the question of, what's being done now that I think it's called Teen Junction, I think is what it was called. The teen center, Teen Junction shut down. What is being done to like fill that gap? And that's certainly not something that All Together can like fill that gap, without the funding and all of that. But, so I'm just curious, like, what are some things that maybe All Together hasn't done that you would love to see us thinking about, doing moving forward with this idea that, knowing that the mental health and the boredom and, using substances for coping is on the forefront. And this is just a brainstorm. So no good idea, no bad idea. It's just, I just want to hear like anything.
Even thinking about, what are the things the activities potentially that All Together could look at, trying to do, but also should we be putting more of a focus on the youth population? Should we be doing more focus on parents and helping get more prevention messaging to parents to talk to their kids? Like, should we be putting more focus on certain populations, or should it just be around, should we continue to do both? Or if folks have ideas around that too, maybe it's not a specific thing we should do, but maybe we should focus on this group versus this group. Or Lauren suggests alcohol retailers.
I know Lebanon has been looking into the idea of having like a community recreational center. And I think that something like that, provides great opportunity, but like that could have a drop-in teen component. And so it's not direct prevention, it's more like, positive community building. So it's prevention, but without that direct prevention message. And I wonder how All Together could help support that effort. I don't know what that would look like, but just an idea.
Yeah, I think that's great, Liz. So Lauren and I, back last year at some point, I think we were part of the initial meeting with the people in the Lebanon's a city, I think. So within the city, where I think it was the recreation department talking about that and getting initial feedback. And I know Angie Leduc, who was on the All Together team, I think she is still part of the recreation, like on the board. So maybe that is something that we could continue to just see how can All Together support that. I think that's a great idea, because that would absolutely be increasing like a protective factor, maybe only for the Lebanon community, unless it was open up to youth all across the region. But that certainly would be increasing, a protective factor for youth in that part of the region. So
yeah, Lindsay put partnering with rec departments to advertise programs and events. I think with the Upper Valley Strong, when that sort of came back at the start of COVID and the creation of the childcare committee, there was some partnership happening with rec departments, specifically around summer camps, and getting sharing information about camps that were available and things that were available for kids to do. So maybe that is looking at continuing to build those relationships with the area rec departments and share some more of those events and what opportunities there are. Not rec departments, and Lindsay, you might know more of this, but rec departments don't necessarily have programs and events for all through adolescence, right? They're typically geared towards younger kids, or there's some rec departments that have events that are more teen based.
Thank you. I will just, so we used to do a teen, well, before COVID, we used to do a teen night. So I would say like the Outdoor Adventures Camp is actually for teenagers. So it does try to access more than like one group. I was also thinking about maybe like the community, like, so just thinking if like Ava Art Gallery would want to like host an event, or if like Scratch, because they do knitting and like they have all that stuff. So just thinking like outside of the box a little bit. And River Valley Community College is there too. So I'm wondering about accessing some of that, like their classes or programs or whatever. Because I saw that Matt put college fairs in the chat, so that reminds me of River Valley being right there too.
Yeah, the reason I put that is, you know, places like River Valley Community College and other schools, when they go to the different schools, the high schools, the tech centers and such, to do the college fairs or career fairs, they really make an effort to have a presence there. And I was thinking it's an ideal opportunity for something like All Together to also have a presence. And it's not just about going to college. It's not just about going to a job. It's also about, you know, helping you with healthier decisions or with struggles you might be having. And, you know, you want to know the most popular place at a football game is the concession stand right next to the bleachers. And any kind of low key, non-threatening, not in your face presence at something like that might be welcome. You know, people might not want to talk to someone about All Together in front of their friends, but they might grab a flyer if it's looks like it's, you know, a low risk thing to do.
Oh, Bob, you're muted.
Sorry. When Lindsay was talking about, had AT ever partnered with the rec departments, and Matt was saying earlier, well, you know, there's so much misinformation out there. I'm wondering if the if we're looking at the youth population as, you know, Lindsay was saying 17 to 21 or 22, or the adult population as which group would be a better target for providing this information. Is there more acceptance within an adult population that have children, or do the younger ones just kind of say, well, I can get it anywhere and it doesn't make any difference? I'm just wondering if you are going to approach places like the rec department or the CCB or some of these, you know, the college fairs, that kind of thing. Is it better to talk to the adults that are bringing their children there, or is it the direct contact that would make more sense in terms of getting rid of misinformation and providing more access?
I'm wondering, thinking about events and tabling at events, which I think, and I'm speaking for Lauren and Andrea, but I think that's something we're excited to hopefully be able to do more of now that we're coming, hopefully, out of this COVID bubble in a sense. And I'm wondering, thinking about things that we could potentially offer at an event, would it make sense for us to look at figuring out how to offer wellness tips? Or one of the other DFC coalitions in New Hampshire, I'm a part of the state DFC calls, they offer wellness bags to students. So it has things, it has like wellness tips in it. It's got like little tchotchkes like chapstick and different things around self-care. So does it make sense for us to think about offering some wellness tips or wellness items, whatever that may be, at a tabling event, as well as information about All Together and some prevention messaging? Thinking about how do we bring that mental health into a tabling event, so it's not just prevention based, that we're looking at the whole picture and including the mental health impact that we're seeing too.
Well, you know, oddly enough, or ironically enough, some of the messaging that could be very positive in terms of mental health going on out there is actually every night in primetime television. Here we are in the midst of the Olympics, and you know, Simone sounds like she was having anxiety attacks, and there's a whole different thing about, growing up within a gymnastics culture, but there are other pro sports athletes who have just said, you know what, I've got to check out here because I need to take care of myself. And, perhaps there'll be, real broad opportunities for people to see, either their heroes or people in the spotlight that are, trying to deal with those issues. And, how does that translate on a local level other than, doing tabling or just even like the awkward ads that we ran. If anything, if somebody is having a mental health issue, if it's nothing more than just the phone number being available 24 hours a day and people get to know that, either the adults, the grandparents, or someone who happens to know someone, it's like 1-800-54-GIANT for Giant Auto Glass. At least I know who to call, or 1-800-NEW-ROOF, or, for a specific problem with a specific resource. And, I think like Matt says, there hasn't been a broad-based specific campaign to address that, but it seems that within COVID, within some of the opiate issues that you're looking at, and this very casual affair with buying weed on the street, in terms of people trying to solve these mental health issues. Who was it? The other one, the athlete a few weeks ago that admit, the track star there, the 100-meter woman who won the thing there, and she found out that her natural mother had died, and she went and smoked a couple of weeds and she got disqualified. So I mean, there's enough dialogue there that if we're looking at our own group here, maybe just being able to put public service announcements on and push that phone number through as the place to go. I'm actually, oddly enough, working with Angie right now with the injury prevention people at CHAD, and we're going to be doing this. It's the car seat thing, beseatsmartnh.org. So we're actually going to be doing a campaign to drive people to the website, because this is great video they have about the 4 steps. And, if we can do the same thing, even on a minimal basis, even if it was something like, the news is next, brought to you by, the mental health hotline or something, that, wouldn't take a lot of resources, but would be readily available across a lot of demographics and a lot of geography. Just some thoughts.
Yeah, Bob, so you brought up a couple of things that I want to mention. So the first thing that I guess I didn't share that we should share is that Lauren and I just went through and became certified trainers of the Connect Suicide Prevention program through NAMI New Hampshire. So we are just 2 additional Connect trainers for the Upper Valley region, which is exciting. So we're hoping to just be able to continue to offer that. And then I'm going through a training. I'm drawing a blank on who created the training, but it's a mental health first aid for youth. It's mostly working with adults that work with youth. It would be training them on the program, but I'll become a trainer and able to implement, train people in that. So those are just 2 more certifications that altogether staff will have to be able to go out and get the adults in the lives of youth trained to recognize the warning signs and be able to point them to resources. So I'm excited about that. The other thing I wanted to point out, Bob, so you're talking about different campaigns, and Lauren put something in the chat. So it reminded me that New Hampshire, the Department of Health and Human Services is giving a very small amount of money to each of the regional public health networks to implement something called this I Care campaign. And it's really nice because it is, bye Liz, thanks for hopping on. It's a campaign that they have already kind of put everything together. They have social media posts made and all the graphics created and things like that. It's really just going to be our job as the regional public health networks to get that information out to the public in whatever way. So then we'll have some additional funding to be able to print up postcards and things like that. So I think that's another campaign like Bob was talking about that we can try to just, get out there to people, and it's all focusing on mental health and the well-being of people. It highlights the suicide hotline. you know, I haven't looked into it too much more, but I think that's you know, definitely another thing that we can do. And I think the nice thing about that is regardless of what is happening with COVID, utilizing media and social media to get information out there and just inundate people and remind them of these hotlines and resources, that's something that we can do all year long, whether life is open or shut down. So yeah, I agree, definitely taking advantage of that. And then maybe I'd love to get a little bit more creative working with Bob and other people on updating some of our campaigns and public service announcements. I think somebody put in the chat having like, you know, a local face, maybe that would sign on to, you know, to record something, somebody that everybody recognizes that, you know, I don't know. So I think those are just all some good ideas, but I wanted to share that we have, you know, some of us are getting trained in that, and others will be trained, you know, as more opportunities come available.
Yeah, we need some local celebrities. So if anyone knows any local celebrities, let us know. Awesome. So looking at the time, I want to make sure we give our partners a chance to provide any updates that they would like to share. And I think this will continue to be a conversation that we have, thinking about the year to come and what that's going to look like, and what activities altogether is going to take on to address what we're seeing. So if you leave this meeting and you have other thoughts or ideas, please let us know. We are just, oh, Lauren's raising her hand. Yes, Lauren.
Sorry, can I just add something I forgot to mention earlier?
Yes.
Just want to, our next meeting is not until the end of September. So I just want to remind everyone that September is National Recovery Month. And there's a lot of events going on, a lot of things in the works being planned right now. I already have a few things we can send out, the minutes and the notes. So we'll be meeting at the end of the month, but I will want to make sure to get those out to you guys so that you're aware of the great events happening for Recovery Month.